I've never taken an Ozempic or any weight loss kind of drug.
Oh, it ended up having a black market. There was somebody selling it outside of a Vineyard Vines illegally or something over there outside of Charlottesville.
Outside of Vineyard Vines,
breaks my heart.
That's the perfect encapsulation.
It breaks my heart. Yeah,
Vineyard Vines selling.
She was a
Ozempic.
Kappa Delta. Somebody said she was a Kappa Delta. I don't know if she was or not,
God!
But it's just that kind of stuff. It shakes me to my core,
God.
JD.
Oh, that's dark shit, man. That's
Shakes
dark. That's
me
darker
to
than
my
a lot of what goes
core.
on in politics. A Kappa Delta selling Ozempic black market out of sight of Vineyard Vines. I'm gonna have nightmares.
They call it faux Zempic.
But I like worry. Okay, so America has a terrible obesity problem. Okay, and I'm not a doctor. I'm not telling if your doctor tells you to take Ozempic, follow your doctor's advice, not what you're hearing from me on a podcast.
Thick. I don't mind it a little,
What I worry about is, okay, you create a problem and then you medicate to solve the problem instead of maybe solving the underlying problem, right?
I think that's it, man. And with that, so staying in the health, in medical and healthcare thoughts.
Yeah.
One of the major, and I wrote this down so I could say it clearly, and to just save everybody time who's listening. One of the major bipartisan issues that's plaguing Americans is the healthcare system, which has become outrageously expensive, right?
Sure.
It's unaffordable. It's inaccessible by millions of Americans. We're overpaying hospitals and insurance companies that hide their prices.
Yes.
And they charge us whatever they want.
Yeah.
Patients overpay, workers overpay, companies overpay, the taxpayers overpay. On this podcast, Bernie Sanders came on and he stressed the need for healthcare price transparency.